everybody. I am super excited about tonight. We have Dr. Alex coming on with us. We're going to talk about old dogs and common eye issues, particularly cataracts. Will be a big thing we'll cover, but also any questions that you guys submitted. You guys submitted a lot of questions actually that were really good. So we're excited to go through that with you. Hello. Hi, Yogi Zen Master. Hi, guys. Let's see. There's Dr. Alex. Let me get him on. How's everyone's weekend been? You guys had a good weekend? There he is. All right. Let me get Dr. Alex on. Hi, Addie. How are you? Always great to see you. You're the best. You know that. I think I got Dr. Alex on. Let me see. Hello.
Hello.
How is it going?
It's good. How are you?
Good. I'm still getting used to the whole it being dark by like 6 o'clock or 6:30 thing.
It is very bizarre.
I
Yes.
know. I
And
like
I get
turn
up in the
on.
morning and it's completely dark as well.
Oh
Yeah.
yeah. It's crazy. I'm like usually there's enough light where I don't have to turn on any lights inside the house to do this. But like every light is
Yeah.
on in here. So
Like lamp,
yeah.
ceiling. There's a lamp right here.
All of the lights. Teach Balance says hi. Hi guys. We're so excited you're here. Addie, yay. Um, so Dr. Alex, so when we posted we were doing this IG live, we had immediately so many questions that came in about old dog eye issues. I really think this is an issue that a lot of pet parents have questions about. Truly, it impacts the way that we, care for those dogs in our homes,
Hmm.
and certainly their quality of life as well. And so we were just super excited you were willing to do the live with us. So thank you so much for being here.
Yeah, absolutely. I'm excited to share the eye knowledge. If you know me, you know I can talk about eyes pretty much at any time, all the
That's great.
time.
Well, good. Well, these people are here for it. Frenetic Slur says, "Talk eyeballs to me,
Yes,
Alex."
I can do it. I can do it.
He's got you covered, Frenetic Slurs. And then Tarantino, Steph. That's actually my aunt Steph has a dog that has uncontrolled diabetes, and cataracts are a really big issue. So
Yeah.
I know she's really interested in being here. So guys, what we're going to do is I'm going to go through some of the pre-submitted questions with Dr. Alex, and I'll ask them to him here. And then if you guys have questions that come up, just put them into there's a question box down there below. That's the best place to put them because I can refer to them really easily. And we'll try to go through some of those as well. This is probably going to be about 20 minutes. So we're going to try to get you guys as much valuable information as we possibly can. So um, let's go with question one. Are you ready?
Let's dive in.
All
Let's do
right.
it.
All right. Okay. So I really liked this question. There was a question about number one, signs of vision problems in dogs
Mm.
and what owners should be looking for at home when it comes to that.
Yeah, I think especially in our aging pets, the most common thing that people will start to report is probably vision loss or like like poor navigation at nighttime
Yeah.
is probably one of the biggest things. Just because with age, advanced age, you can get age-related retinal degeneration, and so that is a diagnosis that you can make on an exam. It doesn't cause any other issues, but it is just a natural aging of the retina that can impact their vision at night. So night vision, I've had kind of recently some clients who have like moved to a new house and now their dog is not able to get around as easily, or
Yeah.
they've rearranged the furniture or something like that. And so that can kind of highlight how well your dog may have been accommodating before, or
Right.
cat may have been accommodating before, and where they are
Right.
now. Um, Big old pupils, in bright lighting should at least be investigated. I will even tell so big pupils in bright light can potentially be abnormal, sign of retinal disease. You can also do like a casual little menace test that I ask some clients to do if we're trying to gauge vision changes at home. It's a very crude test, I'll be honest with you, but
I know
kind of
because it looks like you're
it's
like
yeah, I
fingers
do it
off.
as lightly as possible because you don't want to like fan air on their eyes
Yeah.
because they'll blink that way or hit their whiskers that stick out.
Yeah.
Um, and so just like a very light, I mean, literally just like this is what I do
We had
to help gauge that.
we had an ophthalmologist that would do like a magic finger, like it would be like like almost like throwing like glitter at them, to hopefully avoid the airwave on them, which I always loved. But
Yeah.
Yeah.
But yeah, so those are things I'll use to kind of test, I guess, at home as navigation. If they catch treats, are they not catching anymore? So there's some more obvious things like that.
Okay. That's
But
really helpful. And one of the things that this pet parent had mentioned was that their dog can't seem to spot the water bowl in dim lighting. And
mm,
so that's exactly what you're talking about with decreased vision in at nighttime
hmm
and running into things more often there. I actually leave, it's funny because Orwell, my 16, almost 16-year-old crazy
the
Chinese
old
crested,
crusty man.
old cruster who's on here all the time. He really loves to work a camera, by the way. It's
Yeah.
it's
Oh,
not
yeah.
like
The
it's not.
tongue, the
Oh yeah,
tooth,
and
like
he like looks, like a
he
camera.
knows what's up.
He really knows how to work it. But yeah, so he actually definitely has some changes in his nighttime vision, for sure. And one of the things that we have is, so we have kitty cats in our house, and the dogs get along mostly fine, but Orwell scares the cat sometimes because he sprints after his tennis balls and stuff. So they don't love that. And
Yeah.
then one of our kitty cats loves to do like a little like bat when you walk by, like
Yeah.
even at my legs. So when Orwell walks by, he likes to do that. So Orwell kind of tries to steer around them. And so at nighttime, I actually leave the light on for
hmm
him, like on a dim setting, but just so it's on for him, so he can steer clear of the kitty cats if he
Yep.
needs to, so he can do that. So that's one thing I think that is kind of nice if you do notice that with doggies with nighttime vision, is just leaving a dim light on for them
Yep.
can be helpful to help
Like
them a little
little
bit. Yeah.
night lights. I've had
Yeah.
people do Christmas lights like outside along a fence line or
Oh
something. So it's
yeah.
like on a timer.
Yeah.
So it'll come on strictly for their pet. Or if you take them on a walk, have a flashlight,
Yeah.
things like that.
I love that. Super thoughtful.
Yeah.
Um, let's see. Undercover Towel says it's menacing. It is menacing. That menace test is a menace. Teach Balance One says, I have two 14-year-old pitties. I thought their eyes were good, but now I'll probe them to check. Yeah, always a good idea just to kind of keep tabs
Yeah.
on that. And then Yogi's MS says, Orwell is a supermodel. I think he's a supermodel
It
too,
is a
personally.
supermodel.
A
Yeah.
crusty supermodel. Um, Now, the next question that they had, which I think is really interesting, is about you know can signs of visual deficits be confused with cognitive problems, so doggy
Oh,
dementia.
yeah, for
Um,
sure. Sorry,
yeah,
was that the whole
no, that
question?
was the question I was
Okay,
saying.
good. Yeah, for sure. And that can actually be a really challenging thing to figure out, especially with these dogs, older dogs that have cataracts, and you're trying to determine, will cataract surgery truly improve like their navigation
Right.
and their activity level? Because frankly, I can kind of get a sense a little bit of one or the other in the room with the dog, because and kind of what they're saying, like, oh, are they having like kind of sundowner symptoms? They're getting lost in corners because sometimes these things are happening and their cataracts are not bad enough for those
Right.
things to be happening.
Right.
And so that is another indication to me. But it is definitely challenging. And I think really the biggest thing to me is their age, like how, like if you have an 11-year-old dog, we're not going to be talking about cognitive dysfunction most likely.
Right.
But if you're talking about a 15, 16-year-old dog, then absolutely we'll
Yeah.
be thinking about that and trying to figure out the progression of their signs. Like when did a change happen?
Right.
Like were they fine 3 months ago and then now they have cataracts and now they can't navigate? So kind of setting up a timeline to see what's related,
Right.
what's not. But I've started using or recommending a supplement
Oh
for
yeah, that was
cognitive
a
dysfunction.
question. So
For cognitive, perfect segue. Uh, for cognitive dysfunction called Activate. It's spelled the weirdest way. It's Aktivait, like
okay.
very strange way.
Yeah.
But they even have a like there's some kind of kit that comes with it that has a survey for the owners to take to help them kind of gauge some things. But there's two, I think, studies that they quote that they've done with that, and owners have reported some improvement with that.
That's great.
And I've had a couple clients come back and say, I think it's made a big
Oh
difference.
wow,
So
that's amazing.
yeah,
Um, yeah, I haven't really. It must be pretty new because I really haven't heard of it.
yeah, I've only started honestly this year. I think the first time I heard about it was last year, but I
Okay.
just started
Okay, that's
kind of
fantastic to
mentioning it
know.
as an option just because we're trying to do whatever we can for these dogs.
Oh yeah. And honestly, you know, one of the most upsetting things about doggy dementia is that there really aren't a lot of therapeutic options. Like there are
Yep.
definitely supplements that we can start them on. There's definitely diet, which is really important. There's a lot of things that we can try. There's no sure thing yet, but
Yep.
the more we hear about new things that we can try, like Activate, and if they have studies on it, that's fantastic. You know, the more options we have to try with our patients.
Yeah, for sure.
So teach balance to say, spell it again. It was Aktivait.
Yeah, it's like thinking
Activate.
about the worst way you could spell that word, and that's how you spell it.
That's exactly right. Yeah, and that's great. And I think kind of also one of the things that's interesting, you know, interesting to me too, when it comes to the special sense, when it comes to the senses that animals have, we know that decreases in hearing happens as our dogs get older. We know that decreases in vision happens to our dogs as they get older.
Mhm.
And decrease in hearing certainly is tied into doggy dementia. Now, I know in humans, decreased vision does correlate with higher rates of dementia in humans, but I don't think we have any studies that say that in vet med yet.
Yeah,
But I
for
could
eyes.
only, you know, I would only assume that when you have less stimulation coming into the
Yeah.
brain, there's gonna be less activity there and less things that stimulate them, and therefore it could, you know, accelerate possibly dementia somewhat,
Yeah, for sure.
which is upsetting because a lot of the well, you know, age related hearing, there's no way to prevent it that I know of, right?
Yeah,
Except for not letting your dogs go to rock concerts
right.
all throughout their lives, right? Avoid the rock concerts.
Yes.
But you know, that brings me to one of the other questions, which was, is there anything that they can do to help preserve vision in their dogs that you know of?
So yes and no, I would say. This may be controversial for other veterinary ophthalmology people that may be tuning in. But there is a supplement called OcuGlow that is formulated by veterinary ophthalmologists, and they have it has a lot of claims that it can help slow cataract progression, that it can help with retinal function. So if you do have some age-related retinal degeneration, you can maybe delay that a little bit longer. It's available on Amazon. It's online. OcuGlow, OCUGLO,
Yeah.
OcuGlow. But kind of my biggest issue with that supplement is that there's not a ton of like peer-reviewed studies that really document like the retinal improvement. They've kind of extrapolated from more like rats and rabbit studies rather than
Right.
in the population that we're most interested
Yeah.
in. So I offer that as an option for clients when they're asking about some supplement. It's just with that caveat that we don't have definitive information, but
Right.
it is just a bunch of antioxidants basically,
Yeah.
so it's not going to hurt. And some dogs may have diarrhea or vomiting on it, and that means they just can't tolerate it, so they can't have
Yeah.
that. But most dogs tolerate it fine. So it's like, if it may help, sure, let's try it.
Yeah.
As long as they don't have the GI side
Yeah.
effects. But that's kind of I would say the only one that is, most available.
That
It's
most,
kind of like, yeah.
yeah, I say most, I think when I talk to most ophthalmologists, that is the one they mention. VetriScience has one that's really similar to it, called Clear and Brilliant. It basically has the same ingredients as when I looked at it, but a similar thing where it's kind of like maybe, but
It's like there's some stuff in your lab settings that may help, but it's like, does OcuGlow even penetrate into
right,
the eye? Do any of these supplements actually penetrate where we need
right,
them to be? And those are all
yeah,
questions that I still have.
right,
So I'm just very honest
yeah,
about all of that, because I'm not going to tell you this will improve something.
right,
But there are definitely anecdotes out there of dogs who've had significant retinal disease and then 4 months on OcuGlow and they seem better. So
yeah,
those stories
yeah,
exist, and I don't deny that,
yeah.
but it's just I wish we
Great.
had the studies.
Yeah, exactly. It's that always makes me feel a lot better when recommending
Yeah.
it. And a couple things. So music, TRV, LR, no prescription is needed for that, guys. So no, you can just go and buy it. Always
The
ask your
dosing's on the
vet.
bottle.
Yep, exactly. Ask your vet though before
Mm.
you throw them on. One thing, guys, with supplements is that we get so excited about supplements when it comes to helping support our senior dogs in different ways, whether it's arthritis, doggy dementia, all these different things. Eye health, but we really don't need to put senior dogs on 5 to 10 different supplements. Like you really just need to have them on the ones that are going to impact their life the most after a conversation with their vet, because you just run into this issue where you're probably spending money on things that may not be helping them. And you're, at some point with all the different supplements, they're not benign, right? He mentioned that you can have an upset tummy. Yogi, the Zen master, says Joey, who's her geriatric, really cute, funny little dog, is on it. And I have to give him food before he gets it so he doesn't throw up. So just like Dr. Alex was saying, it can cause upset tummy and stuff like that. So you just got to be careful with this stuff and always talk to your vet about it.
Yeah, because any of the supplements that are out there, even in humans, none of it's regulated.
Yeah.
So, I mean, you're kind of trusting these volunteer certification groups to like try and try and provide some type of analysis, but in the end, all these nutraceuticals and stuff are not regulated. So
and that reminds me, Alex, I'm sure you heard about this in the news recently, but it was super scary. But it was those major airlines that were buying these duped plane parts. Did you hear about that?
No, I did not.
Oh my God, it was a huge issue. There was like a fake company that was selling these like refurbished, really important plane parts.
Oh no.
And these giant airlines were buying it, but just goes to show there was no regulation as far as like where they were getting these supplies, and many planes had them on there. They had to switch them out. It was a really big thing.
Yeah.
But anyways, I digress. So I actually had a question. I gotta get this question because it's a really important question. I kind of want to steer us over to cataracts, because that was one of the big things that people have a lot of questions about. So Tarantino Steph says, Ebony is 10, has diabetes. She is blind from her cataracts. Have not been treating with meds, no eye doctor vets in her area, and she happens to live up in upstate New York. The closest is Cornell, which I think is a several hour drive from her. But I think talk to us about diabetes and cataracts in dogs, and when you consider doing surgery in that group of patients, please.
Yeah, absolutely. So that's one of the main causes of cataracts in dogs is diabetes. The number one cause are genetic or inherited cataracts. So with diabetes, it's really important when your dog is diagnosed with that you should know that over 80, I guess it's 86% of them will develop cataracts within a year to a year and a half of their diagnosis of diabetes. There may be some link to how regulated they are as far as how it relates to the progression of those cataracts, but in general, diabetic cataracts can happen overnight. And so it is a potential cause of acute blindness in dogs. You hope that it takes a little bit longer because it's a little easier for dogs to acclimate that way, but it can happen overnight. So just people need to be aware about that. And they usually are complete cataracts. So they jump straight from no cataract to complete cataract, like a mature cataract, very quickly. And so those dogs are going to need surgery a lot faster in the process than an inherited cataract that may take months to a year or years for it to reach a point that affects their quality of life. So I would say the majority of the diabetic cases require surgery sooner. And because of how quickly those cataracts progress, they can actually cause inflammation inside of the eye. So breeds, specifically like schnauzers, love to get first of all, they get multiple endocrine issues.
Schnauzers love to get like all of the tough things all together.
Everything.
Yes.
I freaking love them, but they get some issues. And they love to go very quickly to mature cataracts, and then they get what's called lens-induced uveitis, which is inflammation inside their eyes. And that can cause damage inside the eye that can prevent them from ever having surgery. So there are some cases that I will operate. I won't wait. Like I won't really wait for them to be on meds for a little bit longer or something like that. But I'll go ahead and operate them. But if you cannot go forward with surgery, then when you reach a mature cataract, because that inflammation can potentially happen, I do recommend they go on a topical non-steroidal anti-inflammatory, flurbiprofen, ketorolac, diclofenac, any of those, and just like once or twice a day to help decrease the risk.
And that's
of
only once they become complete.
Pretty much like a very late immature to a mature and beyond. Absolutely.
Okay.
Yeah. But if you have an incipient, like small little cataract, that's not going to do anything. So.
When with diabetes and dogs, are you not recommending surgery for them, or you're like really hesitant because you're not sure about the results?
So the biggest thing that makes me nervous, I guess, two main things. The first is what's their diabetes regulation. So anesthesia can definitely impact how they're regulated afterwards. It can dysregulate their diabetes, and I have seen some go into like a DKA or
DK, yeah.
diabetic crisis afterwards. So I definitely am one. Not every ophthalmologist does this, but I am one that wants to make sure that they are regulated beforehand, because cataract surgery is an elective procedure in most cases. So I'm not going to risk that complication. And then I also want to look inside their eyes and see, do they have any secondary issues from uveitis? The biggest things that I would see are some adhesions that can form inside the eye. They can potentially get glaucoma, which is high intraocular pressure. All those things are going to drastically decrease their prognosis.
Okay. That's good to know. So if they have inflammation in the eye, if they're not regulated, and if they possibly have glaucoma, then that would help. That would decrease their chances of getting it. And Steph was just saying, Tarantino, Steph, SVT was saying, I was told that if we remove them, that they would probably come back. The cataracts would come back. So talk to us about recurrence with diabetes induced cataracts once you do the surgery
Mm-hmm.
and remove it. Kind of what do you talk to owners about when it comes to that?
So the fortunate thing is the cataract doesn't come back, regardless if you're diabetic or you're not. In surgery, we actually remove as many of the cells that create that lens as possible. And any of the ones that are left over, because they are microscopic. So we do our best to remove all of them. But the ones that are left over can try to replicate again, but most of the time they kind of peter themselves out and just become scar tissue. So a lot of the times the kind of cloudiness or white appearance that comes back after cataract surgery is actually scar tissue rather than the actual cataract. So most of these dogs do stay on a long-term non-steroidal anti-inflammatory even after cataract surgery, because that's been shown in humans that it may help decrease scarring after the surgery. There's only one study of that in dogs, and it didn't show any effect on scar tissue, but they only followed them for 1 year. Versus in humans, you're talking about like decades. So
Yeah.
it's hard to kind of extrapolate that. But so I still do it because it doesn't hurt,
Yeah.
and it may help.
Is the scarring is the scarring often a big issue, or is that just like a smaller chance of that happening, and does it seem to impact vision?
So
Or
I think the biggest question there is, does it actually impact their vision? So in the end, I would say mostly no, it doesn't impact their vision, because there are things that we do in surgery to help decrease, even if some of that scarring comes in, to help decrease its migration over your visual axis. So maybe it just stays off to the periphery. So there's some techniques that we do in surgery to help with that. But like a human, you have to read, you have to drive. We have fine detail focus with our vision versus dogs don't have any of that. So usually they acclimate very well to even just like I call it like dirty sunglasses. You have some smudges, but you can still see.
yeah, yeah.
And since their vision's not nearly as good as ours to begin with, it has less of an impact on them. Now, of course, because I've actually seen, it was a secretary bird, I think, at a zoo, and it had crazy scar tissue over its capsules and or over its lenses. So we actually did go in and remove that scar tissue, but
Wow.
that's probably the only
All
one
right,
though
so
that I've actually had to do
outliers are
anything.
secretary
Yeah.
birds. So in case
And
guys
penguins, I think
and
penguins have really
penguins.
bad scarring. Uh, but it's one of those things, like every dog gets the scar tissue.
Yeah.
So I don't even know if it's really a complication if every dog gets it. It's just kind of what we can do to help minimize where it migrates, I guess.
Okay. And you just said the word that I was gonna kind of ask you about next, which is complications. What complications do you caution? I think you had mentioned them a little bit before, but if you could just go over them again,
Yeah.
that would be amazing for cataract surgery.
So for your ideal candidate for cataract surgery, I'm going to say that's like a 7-year-old mixed breed dog with an inherited cataract. Those dogs have about an 85 to 95% chance of still being visual a year later, and then an 80% chance of being visual 2 years later. So when you start adding age, a really advanced cataract, other, inflammation, all of those are going to kind of take that prognosis and go down. So the biggest things that are going to increase in likelihood are glaucoma. That's the biggest one that we see. So that's high intraocular pressure. And that's probably one of the worst ones, I would say, because it can cause blindness within a day, depending on how high
Wow.
that pressure
Yeah.
goes. So it's one of those things that owners have to monitor for any changes to the eyes and seek emergency evaluation if they're worried about or if they notice
Right.
anything. Because if you can lower the pressure soon enough, they can remain visual. They can have retinal detachments after cataract surgery. Those can potentially be lasered back in place. So while that stinks because they go blind or can go blind from that, you can
Yeah.
hopefully reverse that if you can get to it soon enough to laser it back in place. But there's only, I don't know, 20 people in the country that do retinal reattachment surgery. So we're not trained on how to do
Yeah.
that. You have to do that after you're boarded to learn how to do that. And then they can have inflammation in their eyes that don't go away. And then that inflammation can actually set up for the other two complications.
Gotcha. Okay. And then, so for someone that is interested in getting their eyes evaluated, their dog's eyes evaluated, um, and possibly even getting cataract surgery, I guess more around the cataract surgery, what is the anticipated like recovery time for a dog that has cataract surgery? What do you tell them about to expect with recovery?
Yeah, so it does depend a little bit on the ophthalmologist on what their post-operative protocols are. For mine, they're on a topical antibiotic and a topical anti-inflammatory of some kind, and then a lubricant for their eyes. So there's three things that they get, probably like 3 to 4 times a day for about 2 to 3 weeks. They have to wear an e-collar, so one of those hard plastic cones, no donuts, as the
Yeah.
donuts don't really do much for protecting the face, so they can just smash into something. So hard plastic cone, so they don't rub their eyes because they do have some stitches that are in place that need to not pop. And after that 2 to 3 week period, I start to wean down the anti-inflammatory. I stop the other two eye drops, and then it's just kind of weaning them down on therapy until we get them to their long-term anti-inflammatory once or twice a day.
Okay.
They have to stay calm, for that first few weeks, just so that they don't cause more, because their eyes are kind of delicate after surgery. Well, in general, but especially after surgery.
Yeah.
So any like rough housing, chasing a frisbee, anything like that can actually cause trauma to the eye that can complicate some things.
Okay. Dr. Alex, I'm curious, like, what kind of do you see amazing results as far as quality of life goes with some of these older dogs that you do this cataract surgery on? Like, talk to
Yes.
us about kind of what pet parents come back and tell you about it.
It is.
Curious.
The results really make it my favorite surgery to do. Because we will take dogs who are literally cowering in a corner, shaking, and then the day after they have surgery, they're jumping on me at the door.
Yeah.
As soon as I come in.
Yeah.
I just recently, a few weeks ago, I guess 3 weeks ago, did a 16-year-old Shih Tzu, and the owners were like, she has a lot of life in her. She's still very spunky. Like we think this would really benefit her.
Yeah.
And it absolutely has. I mean, they're like following things outside. They're
Oh,
barking at things again. And they seem just so much more engaged
yeah.
versus I'm just going to sit on this bed, my doggy bed, and watch the world go by or listen to
Yeah.
the world go by,
Yeah.
which, like you were mentioning before, can significantly impact their uh, cognitive ability and stuff like that.
Yeah. No, that sounds amazing. So you said that like after you said that after a dog gets diabetes and if their cataracts come on really quickly, you like to see them pretty quickly in order to do the surgery on them. How quickly is are you talking like weeks,
Yeah,
days? Like,
I would say within a few weeks. We definitely have some that come in and they're like, "How long have they had cataracts?" And they're like 4 months, and that's that can be fine as long as the eyes are tolerating the cataracts at that point.
gotcha.
But I think the biggest thing is once you diagnose that as a regular veterinarian, primary veterinarian, that they have advanced cataracts, they need to go on an anti-inflammatory
Right.
because that's going to buy us a little bit of time um, to get them into surgery, or at least start the evaluation
Yeah.
and kind of see where things go.
Okay. So exciting. I really do think and I feel the same way. Like when we have pet parents that come back after they've gotten cataract surgery, the dogs are like they've got, a new lease on life. It reminds me, that surgery reminds me of how rewarding it is to do a dental on a really old patient
Mm,
where their quality of life in their mouth is wretched and it's got rotten teeth all over it, and you know it's a risk when you go in. You're not, you think they're going to do well, you hope they're going to do well, and you remove as many rotten teeth as you can, and then you see the dog a few weeks later and they're bouncing off the walls. They're all of a sudden
yeah.
sleeping through the night. The owners are like they have a new lease on life. They run like a puppy now. And I think that cataract surgery reminds me a lot of that. A couple comments. Wood Sarah B says, yes, it is the most rewarding thing to see.
That's one
From
of
the,
my
oh,
technicians.
oh yeah. Yay.
Yeah,
Hi,
she's awesome.
Sarah.
Hi, Sarah.
We're glad you're here. Keeping up with the Rogers, just says hearts and thank you. Yeah, it honestly, it sounds super rewarding. And then another question, how many states have vets that can do this surgery? Probably.
Yeah, so I would say most states should have at least one, but one ophthalmologist. um, there you can go to acbo.org, and there's a find an ophthalmologist, and you can type in your state, and it will give you who is in that state.
Perfect.
That's probably the most up to date way to find somebody
Yeah. Okay.
in your area. But they're
Helpful.
definitely not widespread because one thing that I didn't realize, so when we become boarded, we get assigned a number, and they started at one, and we are just now a little over 700,
Oh my
and that is since like
gosh.
1970s.
Wow.
So, and there's only about 400 to 500 still practicing veterinary ophthalmologists in the country. Isn't
Wow.
that wild?
That is wild.
Yeah. So I was like that. But it's also sad because we need way more than that.
Oh yeah. Yeah.
And
I'm sure
that
you guys
gets
are
me into a, yeah,
slammed nonstop. Um,
yeah.
okay. I had one more. Let's just do one more question, guys, and then we'll have to have Dr. Alex back again. Oh yes.
Louis came to say hello.
Hello,
Hi,
Louie.
Louis.
I've got my tyrant that's demanding to go in and out
Yeah.
right now, which is why I'm getting up.
This
Let me
is
say,
this is my rag doll
he's
here. He's a big
so
floof.
handsome. I love him.
Yeah,
Here's my
he's a sweet
crusty.
baby.
There he is.
Can you see him? Oh, look at him. Hi, Orwell.
Crusty McGee is trying to steal the show. Louis is the most handsome
I mean, he's like
I've ever seen.
a big floof. Look at this.
Like you don't even see cats like that anymore. That's what
No,
like I was like so.
he's a rag
Is he?
doll, and that's exactly what he is. You can do whatever you want with him.
Oh, really?
Yep.
I love it.
Yep.
Oh, he's so handsome. Is he kind of like a dog cat, or is he?
Absolutely.
Yeah.
Yep. Comes when
We have a,
called, greets you at the door, screams at you whenever he needs something.
oh my God, I love it.
Yeah,
All right,
very sweet.
let's do one more question, guys, and then we'll see if we can get Dr. Alex back again because I've gone
Yeah,
way over time with him, which I knew would happen. Alex
I
and
know.
me, we were going to be talking a lot.
Well, I was on that podcast before. You're a vet, now what? And I was like, I'm just running my mouth this whole time, and I, I was like, I could have covered so much more if I just didn't talk so much. So,
Yeah,
as I'm doing
no,
right now. So
no,
continue. Sorry.
we're enjoying it. So, okay, so we'll do one more question here, guys, and then we'll let him go. Um, I kind of like this question because I think this is actually a lot more common. It's Orwell. It's collapsing trachea. Don't mind the background noise. Um, it was about senior dogs with weird eyelid growths, and we
Oh
had
yeah.
two questions on that. One was like senior dogs with weird eyelid growths. What gives? Question mark. And the other one was growths on right top bottom eyelid near inner eye, not growing, no surgery, discharge. Should I remove it or not? Which I guess is possible for us to answer here. But if you want to talk a little bit about eyelid growths, we super appreciate
Yeah.
information you have.
Absolutely. So, if cataract surgery is my number one, probably eyelid masses are number two.
I love
Be-
them.
they're so fun. I would say, so in dogs, over 85% of them are benign, which is comforting. that also means we don't have to be as aggressive in most cases to remove them. And so studies have shown that if you can debulk the mass, so just kind of scrape away as much as you can, and then I follow it with something called cryotherapy. So that's freezing. Um, you freeze that area after you've removed the mass, and that has over an 85% chance of preventing it from coming back. And I love that option for our senior pets because you don't have to usually sedate them.
Yeah.
It's all done with like local nerve blocks and things, so they don't feel anything.
You do that with a
And
local,
with local,
and
yeah,
you do cryotherapy with a local. So
absolutely.
you're doing what, lidocaine, like
I do. Well, yeah. So for most of the time, I use just lidocaine, just like point
and
0.3 to 0.5 mils or something, just locally underneath, and then some proparacaine for the eye. And then there's special little eyelid clamps that you can get that help with hemostasis. And then most of those masses are coming from the meibomian glands that line the eyelids.
yeah,
And so sometimes you have to cut open those glands, which sounds worse than it
yeah.
is. And it's basically scrape out the contents and then freeze it.
And
So you do.
are you using like a little bit of sedation or anything, or no? You're just, it's
Only
all
if I need
local.
to. Yeah, it's just all
Wow.
local. I
Okay.
used to sedate them during my residency, and when I came out into private practice, the clinician that I work with was like, "Oh yeah, unless they're crazy, bouncing around in the room, then they can just sit there." And they do. They just sit there.
Oh my God. I'm gonna like
uh,
drive down and come do one of these with you so I can see.
please do. I
Yeah.
mean, it's something that we do same day, like I do hour appointments. And so I literally talk to them about it. We present an estimate, we take them back, and we're done,
Yeah.
within an hour for the
Wow.
whole appointment shebang.
Wow.
And then they're just on a couple anti-inflammatories for like 3 or 4 days because it's usually not that significant of a lesion there. Um, and they do great. And I will say the studies say like 85% successful with that. I personally have had to refreeze, I think, one in the past 2 years, I would say. And that was a gnarly big old mass that should have been surgically removed.
Okay. Yeah.
But the owner, we were like, we couldn't do it. And
Yeah.
so we decided to do free. And it didn't come back until a year later. So I would say even over 85%, definitely
Yeah.
over 85% success. And, as far as older dogs forming these masses, as anyone ages, we get little bumps and growths here and there,
Right.
and sometimes they just form on the eyelids. So smaller is always better when it comes to treating them. Once they become a lot larger, it can definitely become more unpredictable as far as the cryotherapy goes.
Yeah.
And makes it more challenging to know, or more likely to come back, I guess.
Which are the eyelid masses that you get concerned about, or like for an owner? So we talk about how 85% of them are benign, or 80% of them are benign. What about the 15 to 20%? What are you seeing with those that kind of tips you off for people to kind of watch in case they're in that?
Yeah, I would say if it is, I guess, more pink, I guess, rather than like a knobbly gray. If it is erosive, I get a little bit more concerned. So instead of it just being like a little pimple kind of thing on their eyelid, if it's actually starting to kind of eat through the tissue, I'm going to be a little bit more concerned about that. But especially in dogs, I don't get that concerned unless it looks really smooth, like really like deeper in the eyelid.
Yeah.
It's not that kind of friable gray that keeps
Yeah.
being scratched off and
Right.
bleeding, and then it stops and then it regrows. Like that is probably friable means fragile.
Yeah.
Then I'll start to get a little bit more concerned about that. But honestly, a lot of that is experience and just kind of looking at it and being like, does this seem like a normal one or
Yeah.
or not? But I
Yeah.
love that technique. And you'll see, especially as in regular practice or general practice, that they'll have like cryotherapy pens and stuff that use liquid nitrogen. I use nitrous oxide probes, and so it's actually like almost like an oxygen tank of nitrous oxide, and the probe goes directly onto the skin to the lesion, and you can actually push pretty hard on there because you have to make sure you're kind of controlling any of the blood flow in the area. So one, I use the clamps to help limit blood flow
Right.
in. And then when I'm pushing, I'm kind of squeezing out all the blood in that area because blood is warm and it'll counteract the
Oh,
cryotherapy.
wow.
Um, so I like the more direct probes rather than the spray.
Yeah.
I will say I've never used the spray, but I'd be nervous that you're not going to get it cold enough, deep
Yeah.
enough.
That's so crazy. I love that.
I
My
love
favorite,
it. We
yeah, I'm
do it
like,
all the time.
I want to know, I need to get you to tape it for us and definitely to talk about that in our senior dog vet CE, because a lot of GPs may not know about that. The very last thing I was going to say, a really great time that I find to help take care of these eyelid masses is during dentals for your dogs.
Mm-hmm.
It's just, we have them under anesthesia. I can quickly go to the eye and do a surgery on it and remove it. And so you guys, if you guys have dogs that need a dental cleaning and they've got an eyelid mass, ask your vet if it's okay to have it removed at that time. A lot of it too depends on the location, as far as the general practitioners do remove them as well, unless they're a certain size.
Mm-hmm.
If they're too big, then I need to send it to Dr. Alex to go do some crazy flaps or
Yeah.
with
I think it's like
cryotherapy.
bigger than about 25 to 30% of the lid
Yeah,
length. Yeah,
yeah,
it's kind of the
is the
rough.
cutoff for
Yeah,
us.
cutoff.
And so, but as far as general practice, a really great time for us to take care of that is when we were doing a dental on a dog, and because they're under anesthesia anyways, we just take care of it. So,
Yep.
yep, that's it. All right, I think we've got a lot more questions, guys. But Dr. Alex, thank you so much for being here
Yeah,
with us. You're amazing.
absolutely. Thank you
And
for asking me. We
and
need definitely do it again because obviously I
okay,
can talk about this
perfect.
forever. So
We love that. And King and Ollie, you guys bought us a badge. Thank you so much. That means
oh,
that
great.
I have
That's
to take you
awesome.
out to coffee when I come down there to watch the cryotherapy. So
Excellent.
thank you guys so much for the badge. Thanks for being here, guys. We'll do this again. We'll everyone go follow Dr. Alex. He's amazing. He has a bunch of cool reels and things that he talks about and teaches about. So please go follow him. And
Thank
we
you.
will do this again soon.
Yay.
All right.
Excellent. Thank
All right.
you.
No problem. Bye, guys.
Bye.